I tell my patients, you need to look for ways to spend more money on your health.
Mm.
Because if your insurance is covering everything, you're not getting cutting edge stuff.
Ooh, that is a hot take, and you are absolutely right about that. This is Shadow Me Next with Dr. Jeffrey Boone.
I think we've arrived. My goal when I started my career, and then my family, my sons are the CEO, the president, lawyer, director of our company. And I remember a couple of years ago, as I was getting older, and we really had very few doctors that were working with us at that time, and they were thinking, darn, your dream is not going to come true, because my dream is to eradicate heart attacks. I mean,
Right.
literally, and that's possible. And then about 4 years ago, we discovered that yes, we can do that, but you've got to do exactly what Boone Heart tells you to do, which anybody could do. And that really empowered me that now the next step is not only to do it with our patients, which is pretty easy to stop the biggest disease in the history of the world, but how do you get it now to everybody of every socioeconomic class? And you're right, we now have, so to kind of further answer your question, we got now several doctors. We've even got, we're hiring our 9th provider here just this week. It used to be just me like 4 or 5 years ago, but everybody is seeing the possibilities and how free we are. We're unencumbered by insurance or universities or others, but then there's a big trust factor. Like, unless you can trust me, you should just listen to what they're doing in the regular medical world, which is pretty much pedestrian, I think. The approaches are often there. And then what's happened is at the last meeting of the American Heart Association in New Orleans just 3 months ago, the whole convention just switched to becoming preventive cardiology.
Wow.
Because now we have at least 12 medicines beyond statins. Hardly any of them have any side effects that just do incredible things that literally half of America ought to be on. And then we have incredible imaging. Now, the big problem I've always thought, even back in the 80s, how can you treat a disease if you don't measure it? Like, you got to look at the skin and see what's going on. You've got to examine, you've got to find the disease. And so almost every disease, including breast cancer and colon cancer, we do strategies to image the disease. But the biggest disease that kills the most people in the world for the last 100 years, we don't image. We look at risk factors, and cholesterol is not the disease. Blood pressure is not the disease. Blood sugar is not the disease. They're numbers that predict the disease. But we've always been kind of pioneering, how can you actually image the disease? That means you've got to look inside the arteries. And so beginning with those CAT scans with Hounsfield, who invented CT, there was a score in 1986 was developed, something called the coronary calcium score. And it measured a part of the plaque. So that now in our world is a pretty pedestrian test, but it measures calcium. And then the other thing, just as a sidebar, I've got a 43-year-old friend that was talking to my daughter-in-law, and she had a mammogram at 43, and they discovered no breast cancer, but they discovered calcium in the mammary artery, which is a simple heart scan. If you have calcium in the mammary artery, you've got atherosclerosis, you've got heart disease. So if we could get the red ribbon and the pink dress programs together, you could save 10 times more lives with mammograms if you just looked at the calcium in the mammary artery. So there's a lot of little correlations that would empower people. The same thing in dentistry. If you see calcium in some of the images they take of your teeth, you've got the disease that will kill you. Half of America is all of America will die of atherosclerosis at some point. Half of them, something else will get them first, And so it is the disease, and it doesn't hurt. And you look great in your coffin when you die young.
There you go. Yes.
And then as I get older, 80's not old, 90's not old if you're 90. And I think you can prevent all those things. So imaging, very important. Now, calcium score, quick scan of the heart, you can go down and get those for cash for $100 now. But then most people aren't empowered to do anything. If you've got calcium in any artery, you need to treat atherosclerosis. You've got cancer at that point, in my mind, metastatic atherosclerosis, and it needs to be treated aggressively. And aggressive might just be vitamins, risk factor control, GLP-1s, PCSK9s, statins, aspirin, all kinds of vitamins, omega-3 fish oils. I mean, there's dozens of therapies that will stop the process, halt the process, and we now know even reverse the process.
It's incredible. I
It
mean,
is amazing.
it is just incredible. And thinking about this in terms of cancer and how, if somebody said you have cancer, but it's just a little bit of cancer, so we'll just wait until it's just, I mean, it makes no sense when you
Yes.
think about it that way. So why should we not apply it to heart disease as well? I think it was very interesting because what we've always operated under, at least, and not in preventive cardiology, is MIs, heart attacks, always felt very like a surprise, right? All of a
Yes.
sudden you're doing fine, everybody's doing well. And then he just had a heart attack. It was just a surprise. But from what I hear, from what you're telling me, is it doesn't have to be a surprise.
Yes.
If we can not just look at the risk factors, which are helpful, but not really as great as imaging with is that the CAC, the coronary artery?
Yeah.
Is that
Yeah.
what
The
that is?
CAC
Okay.
is that is good. It's not perfect, but it's
Mm,
good. And it's only good if you take any calcium. Now, in 1993, I started thinking of the idea that any calcium score is the disease.
mm,
And that was when there was a lot of naysayers. And now, 30, 40 years later, that's true. If you have any calcium, the plaque as it grows in your arteries will calcify as it tries to heal itself.
mm,
So if you treat any
mm,
calcium like you treat skin cancer,
mhm.
you go after it. You don't wait. Oh, looks like a squamous cell, but let's wait until it gets a little bigger. I mean, it's ridiculous the way we've approached it. And a
Yeah.
lot of it is, I think, hospitals, cardiologists, all well intended, but all the money is waiting until you are sick.
Yeah.
All of the money.
Yeah.
And it is any article, if any doctor, any program tells you that you should wait for symptoms, they are 100% wrong. And that comes out of the humble confidence, is that everybody's now realizing if you wait for chest pain, you've waited too long and you'll be
Hmm.
lucky to live. Now we have all kinds of incredible things we'll do once you get the chest pain. Oh my gosh, all just brilliant stuff is being done at that
Mm,
point, but that's like throwing a fourth quarter Hail Mary in football.
that's right. That's right.
And
And
you're in Tebow land, and that's a lot of fun when you win. But a lot of times the ball doesn't land in hands, as happens occasionally now during the football playoffs. So
it brings me to a really great question, which is I mean, you're working then with patients who, you've mentioned it already, who are asymptomatic. That means they're not
yes,
experiencing this chest pain that you're describing. Their legs aren't, they don't have claudication. They're not
yeah.
experiencing anything. They feel generally healthy. How is caring for somebody who doesn't have symptoms different from treating somebody perhaps with symptoms? Are they motivated?
Yes.
Are they less motivated? What's that look like?
It's interesting. A lot of it is around that area. The best
Hmm,
way to treat heart disease is when you don't feel at all bad.
hmm,
Every part of it should be imaged and aggressively pursued long before you have symptoms. Now, certainly we have a lot of people that have warning symptoms, but really there's a guy named Nick Nur Mohammed from London just did
hmm.
a study of 5 million heart attacks, and 2.5 million had no idea anything was wrong. And at least half of those 2.5 million, a week earlier, their doctor wouldn't have even done much because about
Hmm,
half the people having heart attacks have pretty normal cholesterol. You don't know who to treat until you image.
hmm.
And then when you image, everything falls into line. Your motivation for lifestyle changes might improve, and certainly the safety net of all the various medicines. And we just have incredible medicines. I expect all of my patients to have zero side effects of any medicine.
Wow.
And
Wow.
sometimes it takes 10 or 12 of those
Hmm.
to do the job. And then by 2029, every medicine that I use from GLP-1s to PCSK9s there'll be a generic form of them. So this
Wow.
doesn't have to be expensive. And then I think what you're doing is so well. I think insurance, hospitals, and most physicians will be the last to adopt all these ideas.
Hmm.
Now, I say that with great pride and adulation of what their skills are,
Hmm.
but it's going to take patience to say, I could never have a heart attack or stroke or dementia. It's funny to me that we don't think we know what causes dementia. it's exactly the same risk factor pool as heart disease.
Yep.
So we think if we clean out the heart, ultimately the heart is just a big pump in the middle of 60,000 miles of blood vessels. And those blood vessels go everywhere. So if you clean out the blood vessels, my patients don't have to be highly educated to understand, oh, I bet you're cleaning out the 30,000 miles of blood vessels that float around our brain. And most of them would think, yeah, those little brain cells sitting along those blood vessels probably get well nourished and may
Hmm.
come back to life. So I think we're on the verge of curing most of dementia. Now,
Oh,
that's on top of a lifestyle and a genetic overlay. Though I tend to look at broad strokes, but it's more like discovering who might not benefit rather than who's going to benefit, because I think everyone will benefit from those approaches. So the preventive cardiology approach. Then, well, at this American Heart meetings, amazingly, it transitioned to where the coolest thing at the meeting, and this is, guys from London, Harvard, Korea that are presenting all the data, you could just sense the audience realizing, oh my gosh, we could prevent it all.
wow.
And they would actually, some of these lectures were getting standing ovations, and some of the lectures were about the medicines that are
Hmm.
unprecedented. And one of the biggest trials was called Vesalius, about a PCSK9 inhibitor, evolocumab or Repatha.
Hmm.
And it was the first big study that proved that you don't have to wait for chest pain to treat with this aggressive plaque
Wow.
reversing and cholesterol controlling medicine. And then I was getting pointed out from the podium of, yeah, Boone over there's been doing this for 20, 30 years. And so that
Yes.
was all of a sudden, I was not just capital C crazy, but lowercase crazy. He's been doing this for a while. And then on the other side, the imaging is unbelievable. I was at Montreal at the world meetings of the Society of Cardiovascular CT. And at the start of the meeting, they now can image the heart way beyond the CAC or the calcium score
Mm,
to
wow.
actually look inside the blood vessels. And amazingly, it went from the start of that convention where everybody said, oh, we could never do this on a whole population. By the 3 days later at the end of the convention, the whole place was saying, artificial intelligence is going to score this stuff. All we as radiologists and cardiologists have to do is overlook the data and make sure it hasn't made a mistake.
Wow.
But I think the coronary CTA will be like a colonoscopy in 10 years, and
Hmm.
every 40-year-old will get one. And then they'll decide, and it'll cost $300, and insurance will want it. And I think it was all lining up from imaging to treatment. We've got it all. So in my little clinic here, all I got to do is pass the word around and get the whole world to believe us. We had somebody the other day talking to us about starting Boone Heart Rwanda in the middle of Africa
Wow.
because it's
Wow.
and not that we'll do that, but the whole world could do it, and it doesn't take skill. Like I could do this blindfolded and with no shaky hands because I'm not doing surgery
Amazing.
or stents.
Right.
It's a mindset, and if we can transfer that mindset to the population, and then my sons who are trying to figure out how do we get everybody interested, not just for our own little clinic here, but
Hmm.
how do you
Hmm.
change the world?